Body changes after menopause. After menopause happens, there are body changes that a woman will notice. Changes such as memory problems, poor skin elasticity, decreased muscle tone and strength, problems with bladder function, weight gain, decreased sex drive, vision problems, and urinary tract infections can be observed. Although not all women will experience everything aforementioned, but there are some who will experience most of them. Other body changes after menopause are bone loss. Our bodies are always on the process of replacing whatever part of the body needs to be replaced, and one of which are bones. Women are mostly at risk for bone loss because in the process of replacing broken down bones, the hormone estrogen is much needed. Because after menopause, estrogen is no longer adequate, no replacement is happening while bone breakdown occurs, making a woman prone to bone fractures. Coronary artery disease. In this condition, plaque buildup occurs in the arteries, causing blockage, thus less supply of blood to the heart. High amounts of blood cholesterol could be one of the causes of this disease. Estrogen plays a role in protecting the heart from diseases in women by increasing good cholesterol levels. It is also estrogen that helps in lowering the formation of blood clots and helps improve blood flow to the heart. Due to the decrease of estrogen after menopause, women become at risk of developing this disease and other heart problems. Until the next video, thank you for watching.